Hello, massage nerds. Today we are going to be doing back muscles. I'm going to show you some anatomy and physiology and a few techniques. We've got the latissimus dorsi here, or latissimus dorsi, depending who's pronouncing it. Now remember that these are on both sides, but we just kind of drew them on one side to give you some ideas of how they are layered, because there are like 7 layers of muscles on your back. So latissimus dorsi right here, this is known as your swimmer's muscle when you're, going back and forth with your arms. So this is the lat right here. It originates at the iliac crest, along the transverse processes here, and then it goes like underneath the humerus. And I'm going to talk to you about the rotator cuff muscles. There are 4 rotator cuff muscles: the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. The subscapularis, kind of like a submarine, is underneath the scapula, okay? And even though these are on the scapula, they don't move the scapula. They are really for the shoulder, the shoulder joint, to move the shoulder joint. I'm going to talk to you a little bit about the rhomboids, and the rhomboids do move the scapula. They're for retraction. And we've got the trapezius here, which is 3 muscles in one, because each set of fibers does something different. So we've got your upper trapezius, middle trapezius, lower trapezius, and I'll show you some of the movements. And I also want to show you some techniques for the QL, the quadratus lumborum, because a lot of times people that have low back pain, they really think that it could be even their kidneys, but it's really their QL. So I'm going to show you some techniques for that. You're going to warm up the tissue. You're going to do some skin rolling, some myofascial release before you even start. Or even some cupping. I just did a cupping video. You might want to check that out. And the cupping video, it warms up the tissue because it gets the fascia going. So you might want to do that, or just even some little stretching like this to warm up the fascia. I'm not going to be able to use oil because then it'll smear all the drawings. So let's do what we can. But let's start here with the upper fibers of the upper trapezius. The upper trapezius, like I said, it's on both sides. And the upper trap goes all the way to the 3rd lateral part of your clavicle. So all the meaty part up here, all of this here, this is your upper trap. So one of the things that you want to do is, I like to do this unruffling underneath. It's like I put my hand over the upper trap and all I'm doing is like unruffling here. And while you're here, you want to get the upper fibers of the trap along with the levator scapula. They do, they elevate your shoulders. So you want to do some techniques with this part of your hand, the proximal phalanges. And you can go back and forth. The origin of the levator is from C1, 2, 3, and 4, the transverse processes, and it inserts on the superior medial part of the scapula. And one of the things I like to do is push the scapula, find the border of the scapula, push it up, and go underneath with my fingers and just really massage that insertion. And then you can do the money, right here at the upper trap. So these upper fibers, along with the levator, are for elevation, okay? And depression, so you're elevating, now you're going to depress, it would be the lower fibers of the trap pulling down along with the serratus anterior. So you want to work, this lower fibers too, because it's one muscle, but it works differently, 3 different ways, okay? Also, like for, let me show you for protraction, like when you're going to hug somebody, if you could raise your arm towards me. Okay, let it go here for a minute. You can do some active movement. Is you can take a soft fist and then just move the arm back and forth here, right along the scapula, right along the rhomboids, and you're working these muscles right here that help with elevation abduction and adduction. Since you all are massage therapists, I'm going to use the proper words. You wouldn't say to your client, oh, abduct your arm, because they don't know those terms. They don't know the terminology, but you can say raise your arm. And this one is like you're going up. So this is all that you do. You can do it with your soft fist, or you can do it with your elbow. At the same time, I'm doing active motion here, moving back and forth here. You can get all the fibers of the trapezius here, the superior, middle, and lower fibers. Now, in this position, what I'm going to do from the opposite side of the table, contralateral, you're going to work all the 3 rotator cuff muscles that are on the fossas here. So I just go from this side. Remember that they all insert. The origins are on the medial side of the scapula, and they insert at the tubercle of the humerus. So they all, insert right there. So you can move the fibers back. You can do some skin rolling right over the supraspinatus. Remember the supraspinatus along, supra meaning on top of the scapula, and the deltoid are the ones for abduction. Abduction is the supraspinatus and the deltoid. The supraspinatus is the only muscle of the 4 rotator cuff muscles that does not laterally rotate the shoulder. So the supraspinatus is more for abduction, like abducting, like an alien is abducting you. So this is abduction, this is adduction. And then you go into all the fibers of the teres minor, the infraspinatus, the supraspinatus. You can also put the arm down right here. And, just from this side, like work over with a soft fist over the muscles. And also, you can do some thumb work too. I try not to use my thumbs too much anymore. And remember that the supraspinatus goes underneath the acromion process, and then it inserts right here at the greater tubercle of the humerus, all 3 of them. These are the insertions. These are the origins. So you want to do, I can even do some figure 8s right here. Just working over the rotator cuff muscles here. And while you're here, you can also work right in between. You can work the rhomboids here. And I like to use my legs all the time, just using your legs. And while you're here, you can also work the lat. Remember the lat and the pec major both attach right here underneath the armpit. The pec major also helps, with a shoulder movement. So these are just some techniques that you can do. You can do from across the table, some cross fiber. And actually, can you put your arm back on the table for me? Thank you. So you can use, I like to use like raking. You get the serratus anterior. Serratus anterior is also for pulling the arms back to adduction, adding them back. So now we're going to do retraction. The rhomboids here, right in the middle, right, they go from C7 to T1, and then from T2 to T5, the ones that look like little Christmas trees right here. Those are responsible for retraction. So let's say, oh, thank you, like hug somebody, that's protraction, and now retraction would be pulling them back. There you go. See, can you see how that, these rhomboids are the ones that are working for retraction. And one of the things, okay, relax, thank you. One of the movements that you can do with the arm is raise it yourself. That will be some active range of motion. And you can either raise it up yourself and work it at the same time. Up, down, up, down. Or you can use the hyposthenar part of your hand too, to really work the rhomboids here. And another one that you can do is if you bend the elbow here and then just go underneath here and pull on all the insertions here of the rhomboids, because they go right along the medial part of the scapula. So you lift here with this hand, relax your arm, relax completely. You lift with this hand, and then with this hand, you pull it out. Relax your shoulder. There you go. So now I'm pulling it down. You lift, and then pull down. So that's another technique that you can do. I want to do sideline, because I want to show you how you can get deeper to the QL, and then when you're sideline, you can access the muscles from different areas. For the QL right here, before I get to the sideline, you can also separate the muscles. I'm going up the transverse processes and just separating all the fibers from the spine. This is something that feels really good with people, especially when they're, swimmers, and I know that he's a swimmer. So all of this, this is known as the swimmer's muscle, the lat. So you really want to work that muscle. And all I'm doing is pulling towards me with my fingertips. And then on the opposite side, I'm pushing, separating, just trying to separate the fibers from here. Okay, so I want to show you the QL originates at the iliac crest. So remember, when you put your hands on your hips, that's your iliac crest. So it originates all on the iliac crest, and then it inserts on the floating rib and the transverse processes of the lumbar 1 through 5. So do not put too much pressure on that floating rib. Remember that floating rib, especially on the elderly, you could cause some damage. So I like to use my toolbar, because you go about an inch out. You go about an inch out, and you press where it dips. You palpate to where the floating rib is. His floating rib is like right around here. So I'm not going to put too much pressure here. This is the iliac crest. So I'm going to go into the soft where it dips. And this is the muscle. So I'm going to work on this area here. And I can use my tool, especially with somebody that's a little bit, bigger, if I don't want my thumbs to hurt. So I can work on it, medially to laterally. And I can go softly here on the iliac crest without causing any, like if it's too bony, you don't want to put too much pressure. But you can work all of the origin here. This muscle here can really cause a lot of back pain. So you want to go, work from the medial to lateral, medial to lateral. And here on the floating rib, very light pressure all around here. Or you can use your fingertips. So this is a good way. The QL, the quadratus lumborum, is the deepest back muscle, because it's almost like right up against your abdominal area. So this is a very deep muscle. You can also use your elbow. If you measure, make sure you're in that little dip right there. Like you measure, you push. I'm pushing, towards that way. And I can really get to that QL. And if there is pain, you can hold it there for, anywhere from 20 seconds to 30 seconds. And make sure you ask your client to breathe, and you don't take it above a level 7 at the most of pain. You don't want to cause pain. I know some people have high tolerance of pain, so you want to keep it in a comfortable level, like 5, 6, 7 is a good number. But if they say it's a 10, you back off. And again, you can do some skin rolling around this area just to kind of lift the fascia. You can even do some C bowing, like you lift and you turn it like into a C with your thumbs. This really helps to loosen up the fascia and to loosen up that QL that's sometimes just really tight. And you can also do some cupping. I did a cupping video recently, and I love the cupping because you can use the cupping to move it around and to really lift the fascia and the muscle. So that would be a good video to look at too. So anyway, when you're done, you know, you're going to bring it all together. You're going to do your long effleurage. You know, you can do even your elbows all the way from the top. You know, you're using your legs. Remember, you're using your legs. I'm not just doing this because you're going to mess up your shoulder. We're trying to save the rotator cuff. So you're going to just use your legs to go all the way up and down. That way you tie it all back together. Now I want to show you some sideline positions. Okay, so when you turn your client's sideline, you got to make sure that their spine is kind of straight, you know. I know somebody questioned me and says, oh, but there's, you know, I see a curve. Well, they're the natural curves, you know, but you want to make sure that their cervicals are being supported by a pillow, that the bottom leg is straight, and that the top leg is over another pillow. So that way they don't put so much pressure on the hips. So once they're supported properly, then you can get to the rest of the, you know, the muscles to work on them. For the sake of the video, I'm going to be on this side. I like to be on that opposite side, but this is a good place to kind of rake over the origin of the QL. So I'm going over the QL all along the iliac crest, which actually sideline works really good for this. And you can take it all the way up, even to do the serratus. This is a great place to work the serratus anterior. The serratus anterior is the one that looks like a serrated knife, and it's the one that you use to deliver a punch. So this is, I love that muscle. And we didn't draw that one today, but today it's not about the serratus. So you can take it all the way up, and then I like to get my tool. Like I said, I would be on that side. This really exposes the QL. The sideline position makes it easier for you to find the QL, the belly of the QL, and really work it out. So I would, you know, I would be going just medial to lateral till it starts dipping. So I would start here close to the transverse processes, and then work out laterally until I see that it feels that it dips, and then I would work that QL right there. So this is a good way. I use this tool a lot now to save my hands. So, but if you don't have the tool, you can just pull out, and then right there, it dips right there. That's where I feel it. That's the belly of the muscle. That's where I would work. So anyway, that's how you would work the QL, which is a very important muscle because it's the hip hiker. You can also ask your client to hike their hip like towards you, you know, while you're working on it. But, you know, that will be just some active motion there. So let me show you some techniques for the supraspinatus, infraspinatus, and teres minor. You can ask your client to hold up their arm right here. And this is, make sure that it's kind of straight, but with your hand. And please be careful, because a lot of times this is ticklish and it feels uncomfortable. So let your client know what you're going to do. But you can get the lat. Remember I was telling you about the lat? It's drawn on the other side. But the axillary fold, this posterior axillary fold is the lat. So for someone that swims, like Vince here, I want to make sure and get the posterior lat right here. All I'm doing is kind of like a grip, like a vice grip with my hands, and getting all those fibers there to release some of that stress and tension from the swimming. Okay, so then while his arm is in this position too, I can work all around the scapula here. This gives you easy access to moving the scapula around here. And once you're done with that, you can ask your client to, whatever's comfortable, maybe put it up. Relax the arm completely so it hangs down, and then you can even really work the supraspinatus, the infraspinatus, the teres minor down here. So I really like sideline. When you put the arm, let the arm hang down, it kind of brings the scapula out more. So you're able to work all along the scapula here and really work these muscles here. You know, like I said, you can do the gripping. You know, you can do the forearm. You can even do specific work here if you need to, but be careful, because these A lot of times, oh, I can tell that's a trigger point right there. Ooh, is that more than a 6, 7? Yeah, right there. No more than that, I can tell. So I would hold this for like 20 to 30 seconds because I could tell right away that's really extremely tight. And I'm sure that's from swimming too. Teres major, and the teres major is known as the lats helper because both of them are for swimming. So, ooh, right there, it's really tight. I can feel that. So I would just do some circular motions there, hold that trigger point for a little bit. You can work the deltoid here. This is a really good access to the deltoid right here. You know, the deltoid, like the trapezius, has 3 parts: anterior fibers, middle fibers, posterior fibers. And from here, this is another good one that you can do. I'm doing the hypothenar part of my relaxed arm. I'll move it. You know, of my hands, and then just pulling out. Now, of course, if I had oil or lotion, it would move a lot better. I'm gonna do some pulling, do some traction on the scapula towards me, and you can also do some movements here. You know. And you can work the levator. Remember the levator here? So this is another way that you can open up the neck right here to do some work here on the supraspinatus. The supraspinatus, even with a soft fist. This is what I call my taco fist, soft fist, right here. And you can also go here with your knuckle there all along the upper trap and the levator all along right here. And if you want to get him or your client also a little deeper, is you get your forearm to push, and then so this is what I'm doing. I'm putting my knuckle there. I'm almost like on the posterior scalenes, the upper trap, then I'm pushing with my forearm, I'm pushing this, so I'm kind of trapping right there, that muscle. That could be painful on people, but that really gets the levator and the upper trap to release right there. So this is all I'm doing, pushing with my forearm right at his elbow. His arm is bent. Another good technique. And like I said, at the end, you want to do some nerve ending strokes. Really helps your client to relax, because this is intense work. When you do specific work, neuromuscular work or medical work, it's very intense. It's not like a Swedish massage. They don't get to relax. You're very engaged with your client, asking them questions, getting them to breathe. So you don't want to, you know, oversaturate the muscles where they start just shutting down. So you want to make sure and do some effleurage, petrissage, and some nerve ending strokes. So you've got some anatomy, some colorful, beautiful drawings, and I hope this helps you kind of see where they go. The trapezius is the most superficial. The QL is deep. The rhomboids are underneath the trap. So there's 7 layers, guys. So you got to peel them off and work on all of them. The best way to work on them is take them through their motion of what they do and work on them. Like protraction, you know, you work the pec and the serratus, and then retraction would be the middle fibers of the trap and the rhomboids. So take your muscles through the movements that they do in order for you to get a better results, and it'll help your clients, I guarantee you. So I hope you enjoyed this video. Make sure you give it a like, subscribe, share with your friends, and I truly appreciate your support. Until the next time, create a great day.